This weekend, former President Joe Biden announced to the world that he has been diagnosed with stage 4 prostate cancer. Although the former president described his condition as currently manageable, his diagnosis has sparked a renewed discussion surrounding prostate cancer awareness. Joining us today in studio to talk about screenings, treatment, and answer some frequently asked questions is Dr. Daoud Dajani, prostate cancer specialist at the University of Maryland Capital Region Medical Center. Dr. Dajani, thank you so much for joining us today.
Thank you so much for having me.
So, following the former president's announcement, we saw a spike of internet searches with questions of what does a prostate do and what happens when you do develop prostate cancer. Can you give our viewers just a brief overview of what this cancer entails, but also how does a prostate function within your body?
So the prostate is a gland that sits kind of, after your bladder. Its job is mostly to secrete the fluid, the ejaculate, the seminal fluid. The sperm comes from the testicle, but the fluid itself comes from the prostate, and that's its main job. As the prostate enlarges in size, it can cause some urinary symptoms and things like that. So prostate cancer is when a man gets cancer in this gland.
And so can you share with us maybe some of the early signs and symptoms of something that you could possibly have contracted or developed this type of cancer?
Sure. Actually, most of the cancer at first is silent. Some people refer to it as a silent killer because a lot of men don't have any signs and symptoms until it's fairly late in the disease, such as, for example, difficult urinating, blood in the urine sometimes. Most of the signs happen when the cancer becomes really aggressive and it spreads. For example, it can spread to the bones, it can cause a lot of bone pain, losing weight. That being said, not every man who has difficulty urinating or increased urinating that immediately should mean prostate cancer, because there are a lot of things that cause that, more commonly an enlarged prostate.
And so studies are showing that black men and also Hispanic men are not only at an increased, they're at an increased risk of contracting this type of cancer, but they're also at an increased risk of dying from this cancer once it is contracted. What are some of the factors that are influencing this statistic?
So, prostate cancer, for example, of 2024, 308,000 men were diagnosed with the disease in the United States and 35,000 deaths. Genetically, we know that African American men have more commonly the disease of prostate cancer, but not only that, more aggressively. They have, more aggressive phenotypes. It tends to run in families. There are certain genetic mutations that can sometimes be involved. So, when, for example, I see a patient who is African American, immediately the way I think of the prostate cancer and screening, and I'm definitely more aggressive in screening those patients and having these discussions with them.
Right, so early detection for this type of cancer is definitely at a premium.
Absolutely. So, the way we look at it, generally men should start thinking about prostate cancer screening in their 50s. However, when someone has risk factors such as a family history or African American ancestry, I would definitely start that conversation in the 40s, early in the 40s.
And so, as we know, technology continues to evolve in the 21st century. What are some of the newest developments within prostate cancer treatment, but also preventative measures that people can start to take as well?
So as far as prevention, sometimes there are things that are within our control and some things that are not. So, the genetic factors, the race, there's nothing you can do about that. It's just a higher risk. There have been some studies that show that, generally obesity and certain diets that are high, for example, in red meat or in dairy, can increase the risk of prostate cancer. So generally being healthy, eating healthy, exercising, all that can bring the number down. I think the most important thing is for people at an increased risk especially is to start the screening process early, which is at least, visit with the primary care physician, a blood test that's called the PSA or the prostate-specific antigen to get that checked, and then start that process early enough.
Dr. Dajani, I want to talk about what happens when this type of cancer is left untreated. What are some of the things that happen within your body that can affect your quality of life, your sexual health, and even your urinary function?
Sure. So, prostate cancer, it comes in risks. There's low risk, medium risk, and high risk. And some low risk cancers can actually be observed for long period of time. The cancer, the idea that this is what we strive to do is to catch it early, especially if it's in an aggressive form, treat it early before someone gets to that point where it's affecting their bodily functions. Most of the effect on someone has when the disease is really, really aggressive, especially if it starts spreading to the bones, to the lymph nodes. The prostate itself can even, grow into the bladder, cause bleeding, urinary retention, difficulty urinating, things like that. All that is if it's left untreated. It can definitely happen. It can cause losing weight quickly, and it can be very uncomfortable. It can definitely decrease quality of life for patients.
Can you tell us about some of the resources that people can get to, whether it might be nationally or even right here in Maryland for families or even patients who have prostate cancer?
Sure. So, definitely I think primary care physicians are an excellent resource. They're all very well trained. They check, screening early, but of course us as urologists, we're also available. Here in Prince George's County, we at the University of Maryland Capital Region, we have a robust prostate cancer program. We have, like myself, surgeons. There are also radiation oncologists. There are medical oncologists. We have a full team that can offer support to patients. And even after treatment, we have a team that can help people with their quality of life, with the recovery, with everything. I mean, we have a full support here for that.
So we're going to let you go soon, but we do want to ask you, what is one thing that you want to leave our audience with from this about prostate cancer, but also maybe something to encourage our audience members to start getting regular checkups and screenings for prostate cancer?
Sure. As I said, I came to Prince George's County. I used to practice in Northern Virginia for about 7-8 years. And I think in 2 years here, I've seen way more advanced and way more aggressive cancer. So, I think the message is, if you're someone, first of all, start at least the conversation in your 50s. If you're someone at a higher risk, such as, an African-American male or have family members, whether it's, siblings, cousins, dad, something like that, start the conversation even earlier in the 40s, because I think the best thing for this disease is to catch it early and treat it early. Not every cancer needs aggressive surgery or aggressive treatments like radiation, but some do. And people have the notion sometimes that if I get treatment for prostate cancer, I'm going to have all these, difficulties. I'm going to be, have difficulty with erections or leaking urine, and there's a lot of things that can be done to kind of fix that. So I definitely recommend early screening and early detection for that.
Dr. Dajani, thank you so much for joining us today in studio. And for more information about prostate screening and health, you can visit the Prostate Cancer Foundation website at pcf.org.